Welcome back. I'm Dr. Cheek and I'm a licensed clinical psychologist. And today I'm going to talk a little bit about how do you find affordable mental health services. Right now in today's economy, if you are looking for individual or couples therapy or family therapy, you can find sessions ranging from $125 an hour to $275 an hour or more. And there are many reasons why mental health can be expensive when you're seeking mental health with private practices. And these are some more affordable options. So when we think about affordability, sometimes we have to think a little bit outside of the box. Now, you may have to look for state-funded or nonprofit or community-based organizations that provide mental health services. Now, the advantage of that is that you may be able to find mental health services at a more affordable rate. Sometimes you have the ability to get free services in these facilities, whether it's state-funded, whether it's nonprofit, whether it's community-based, you may be able to get services free of charge. The disadvantages are things such as you may not be able to get individual therapy services. And the reason you may not be able to get individual therapy services is because it's not enough funding to be able to provide individual services. It also may be due to high demands. They may not have the availability to provide individual services. So most of the time when you're looking at community-based or state-funded mental health or behavioral health services or not-for-profit mental health services, most of the time what you may find are group opportunities. So you may only have access to group services. And when I say group, that may be in the form of support groups. So you may have access to things such as like grief support or support with dealing with family members with serious mental illness. These are the organizations that provide those types of mental health services, those support group types of services. And sometimes you can find that in your local hospitals because most hospitals are considered nonprofit organizations. So it may be helpful to research state-funded or nonprofit mental health services, and that way you may be able to get affordable services or free services in those arenas. Again, I want to highlight that you may not have the ability to see someone individually. That may be the only opportunity for group, and also there may be less likelihood of you seeing someone who specializes in certain areas of treatment or certain evidence-based practices such as EMDR or prolonged exposure or DBT or any of those specialized trainings. That may not be what you find in community-based or state-funded behavioral health mental health services, but it's a more affordable access to mental health. Now, another way of getting affordable mental health services when we look into the private sector or individuals who have private practices would be for you to ask if they provide services on a sliding scale, which means that your fee for the service will be based on your income or your ability to pay certain amounts. And it is normally going to be based on your monthly income. Now, this could be for individual treatment, this could be for couples treatment, this could be for treatment for children and adolescents, this can also be for evaluations. So ask the mental health clinician whether you're going to see a social worker or a psychologist for mental health services, for therapy services, or you're going to see a psychologist for an evaluation. Ask if they have a sliding scale or if they have availability or do they provide slots in a month or a year for pro bono services or free services. And that again is going to be dependent on availability or if they actually offer those services, and not all providers offer those services. So that's another opportunity. And when we're thinking about private practice, sometimes master's level clinicians may offer therapy services at a different rate. I know recently I was researching and I found some clinicians that were on the master's level. And when I say master's level, I'm talking about clinical social workers, licensed practicing counselors or LPCs. I'm talking about addiction specialists. All of those types of counselors or therapy services may offer services at a different rate. And that rate could be like $80 a session. And sometimes that $80 may still be too much for any one person to be able to afford on a weekly or even monthly basis. But they have different rates. So different providers, master's level versus doctorate levels, also offer different rates for their therapy services. That's an option as well when we're thinking about private practice or private sector therapy services. Another opportunity or another option is employee assistance programs. And I know there's a concern as it relates to confidentiality or privacy when dealing with EAP programs or your employer having access to your private information. But EAP programs have to follow the same HIPAA guidelines as any other mental health clinician. They cannot share your information without some type of subpoena or release release of information from you as the client. Now, there are exceptions to that law. So I would encourage you to actually research the exceptions to those EAP confidentiality laws in each of your states, because each state, it will be different. There are some states where they can get access. If it's a mandatory service by your employer, then your employer may have access to those mental health records. And that's because of the EAP laws in that specific area. So know the EAP laws in your area if you're considering using EAP. And most of the time, EAP services, you get maybe, let's say, anywhere from 6 to 20 sessions for free, and it's covered by your employer. So that's an option as far as it relates to being able to get affordable mental health services. Now, the last way of possibly getting affordable mental health services is through your insurance company. So if you have medical insurance, if you have Medicaid, if you have Medicare, if you are getting insurance off of the marketplace through the Affordable Care Act, or what some people consider Obamacare, you may have access to mental health services. And you may want to check your benefits package to see if you do have access to mental health care services. And if you do have access to mental health care services, find out like how many sessions are covered. What is your copay? Can you afford that copay? What providers are in your network? What providers are outside of your network? Also, in private practices, what providers are accepting insurance? Because not all private practices accept insurance. Some of them only accept fee-based or cash-based payments. So just know that if you're looking for someone in the private practice, just make sure they do accept your insurance and that they are listed as a provider within your network. So these are just a few ways of finding more affordable mental health services. I know it's not easy. I know it's a process, but when we want access to certain things, we're willing to do the work. And that's one of the ways that we may have to do the work. We may have to research the things that are available to us that may not lead to us actually getting specialized treatment, that may lead to us actually getting group treatment until we have more financial stability in order to go to more specialized treatment. It may look like us asking providers if they have a sliding scale so we can afford to pay out of pocket if we need to pay out of pocket. There are ways to get mental health services. It may not always be what we're wanting. It may not always be the gold standard of treatment, but sometimes we are able to get access to certain mental health services that can help us maintain our stability until we're able to have access to those more evidence-based or gold standard of treatments, so we're able to get the level of help that we're wanting in those times. So some of the ways to look for affordable mental health care is by looking for state-funded or community-based or nonprofit organizations, to ask about a sliding scale, to look to your insurance to see if the mental health benefits are covered under your insurance, and possibly to utilize your employee assistance program or your EAP program. I've talked about each one of these extensively with the understanding that mental health services is not expensive, and why mental health services may be expensive is because of the costs that sometimes go into the service itself, and understanding the level of training that some providers actually have in order to offer some of the services that they're able to offer and to be certified in some of those evidence-based treatments. Mental health is something that we all want. It's something that we all should have access to, and there are ways that we have access to it. And we may not always have access to it in the ways that we want in certain times, but there are certain ways that we can access mental health that it's more cost efficient for us and also gets our needs met as well. As always, I hope you take something from this video that was helpful and useful and important. Feel free to jot down any thoughts, questions, or comments you have below. I thank you for taking the time to listen, and I'll be seeing you again very soon. Thank you.